Hello, and welcome to the University of Utah's Acute Care Physical Therapy Residency Program Information Session. My name is Emma Johnson, and I am the Program Coordinator. Thank you for your interest in learning more about our residency. Over the past several years, the opportunity to participate in a residency program has grown. As of 2023, there are now 13 accredited acute care physical therapy residency programs, with 4 more programs awaiting accreditation. So why choose residency? Residency is a unique learning opportunity designed with the sole purpose of giving one exceptional resident the absolute best experiences we have available to help grow their clinical skills, professionalism, and knowledge so they can be the best clinician possible in their area of specialty interest. We foster an environment where the primary focus is on your learning, and we support this through extensive educational opportunities and mentorship that non-residents do not receive. Our hope is that we provide you with the skills, knowledge, and experience to set you apart from the other thousands of DPTs out there. Our goal at the end of your residency is that you will feel well prepared to do more than just practice, but to also teach, become involved in research, and engage your community to advance and elevate our profession. On the flip side, what's in it for us, your leadership and mentoring team? Why do we donate our time to helping a resident become an expert clinician? It's because we all believe in progressing our profession and supporting those who want to advance our practice. Additionally, the most common feedback from mentors is that having a resident inspires them to continue learning and help grow their contribution to the advancement of PT. So I specialize in acute care. Currently, more than 30% of PT jobs are in acute care settings. It's an incredibly fast-growing job market, with growing research supporting increased PT utilization in acute care. There's just not enough acute care education, especially critical care education, in DPT programs, and residency helps fill that gap, as well as provides the opportunity to work as part of an interdisciplinary team. Our program has been accredited since 2022. It is 12 months long, and we take 1 resident per year. Our mission is to provide qualified physical therapists with advanced knowledge and clinical skill in the management of individuals who are acutely hospitalized for various diagnoses. Some highlights of our program include that because we only take 1 resident per year, this allows us to individualize the program to meet your specific residency goals. Our schedule allows for rotation through each unique unit at our Level 1 trauma hospital. We provide intensive mentoring, with each resident completing close to 200 hours of one-on-one mentoring with highly skilled and specialized clinician mentors. Our residents become employees of the University of Utah Health and Clinics for the duration of the program, with full benefits and compensation. Additionally, we provide opportunities for observations in interdisciplinary, surgical, interventional, and testing procedures in various settings for experiencing the entire picture of patient care. Our program leadership consists of myself, our program director, Haley Bento, and our clinical director at the hospital, Chris Noren. Our physical therapy team already practices within a team-based model, which supports our mentors being able to specialize within their area of practice. For example, when you're on your neuro rotation or your ortho rotation or your critical care rotation, you will have the opportunity to work with mentors who practice almost exclusively within that specific area. We currently have 3 mentors who are board certified, as well as 1 who is awaiting results from the 2023 examination. We're on Instagram, so follow us at Utah Acute PT Residency. Our Instagram features what our current and previous residents are doing, as well as more information about our program. Our program consists of all the components listed here. The expectation is that the combination of all of these elements will create a full-time or slightly more than 40-hour per week commitment. It's important to remember that the goal at the end of the year is that you will be practicing at specialist level, and that requires hard work and dedication to all of these pieces. Each of these components can be developed further past the minimum requirement depending on your specific interest and residency goals. Our schedule features 11 unique rotations in 9 unique areas of practice. Each rotation is approximately 1 month each, with about 50% of your time spent in critical care. Here's an example of an opportunity we provide for our resident. When you are on a surgical rotation, you will be able to observe surgery with a patient and then follow up with them post-op for their evaluation and treatment. In addition to your primary clinical rotations, we also offer part-time clinical experiences. Some examples include pelvic floor health, lymphedema, wound care, emergency department, neonatal care in the NICU, inpatient psychiatry, and 3D printing. The amount of time that you spend in these different settings can be dependent on your specific interest, as well as if you have interest in another opportunity not listed here, we can work on creating that experience for you. Here's an example of what the first half of your residency year might look like. As you can see, we have didactics specific to the rotation you're on, as well as teaching and other opportunities to further support your learning within that specific rotation. And this is an example of what the second half of your residency year might look like. For some of your rotations, we block your time to provide you with the most comprehensive experience of what a patient's time in acute care might look like. For example, you will rotate through the neuroacute floor and then the neuro ICU on adjacent months, and then our cardiac step-down unit and our cardiac ICU on adjacent months. Our didactics include online webinars through PT CardioEd and MedBridge, in-person courses like our ICU nursing education, as well as our in-house education series like our therapy grand rounds, and then certifications and trainings in advanced cardiac life support, durable and temporary VAD training, and level 1 or level 2 APTA CI credentialing. Gaining experience in teaching is essential to helping you develop as a resident. One of the best ways to test your understanding of a subject is to teach it to others. We provide opportunities for you to teach within our DPT cardiopulmonary management course as a lab assistant, as well as a handful of lectures, in our doctoral seminars, which is education in small groups with a focus on critically appraising and applying research, as well as nursing education and staff in-services, such as our therapy grand rounds. Additionally, we hope that your involvement in teaching DPT students will help inspire them to pursue specialization and residency participation. Here's an example of what a mentoring session might look like. All of our mentoring sessions are one-on-one time between our resident and our mentor, and it's a time for both clinicians to reflect upon and critically think through specific patient cases. We also offer a wide array of interdisciplinary days to learn from those who know it best. You will have the opportunity to learn from surgeons and OR nurses during your surgical rotations, learn about ventilators and other respiratory interventions from respiratory therapists, from ICU nurses, occupational therapists, and all the members of the various clinics. We have a research requirement for residents and keep the terms of it pretty broad to allow for your interest and creativity to flourish. Our PT team always has some ongoing project that you can become involved in, or you can work to develop your own. Delivering in-services to staff is another requirement of our residents, and similar to the research requirement, we want your curiosity to shine. At any point during your year, if you develop a clinical or process question and explore the how and why, we want you to share what you've discovered to help all of our staff learn and grow. Also, we love teamwork. In previous years, our residents have collaborated on in-services. This specific post features a collaboration between our acute resident and our program director on defining acute care. Is it a setting or a specialty? We also want residents to be able to give back to the community and be involved in outreach. We hope that service is a central theme of residency year and provide an array of service opportunities, some of which are listed here. So what sets us apart? As I've already stated, we have extensive outpatient clinic experience opportunities, as well as acute care opportunities to provide you with an in-depth understanding of the entire care continuum for our patients. We are a level 1 trauma center that has been a top 10 hospital in quality for the last 13 years. We have ECMO, VAD, and transplant programs. We are a teaching hospital, which not only provides us with opportunities for research involvement, but also creates a culture of learning, not only within the therapy department, but across interdisciplinary teams. We have a close relationship with the DPT program, and we have an excellent understanding of work-life balance with unmatched access to recreate in the beautiful landscape around us. Here's a visual of where you will be working and living as a part of our residency program. The yellow star is where our hospital is within the Salt Lake Valley. 5 minutes out the back of the hospital, and you can be on the trails in the foothills of the Wasatch Mountains. And within a 30-minute drive, you can be in the mountains, hiking, biking, running, and skiing. We have a starting salary seen here, which is fully benefited and at the 0.75 full-time equivalent. It is also dependent on the amount of practice experience you have prior to residency. Additionally, it includes educational funds for continuing education and conference attendance. We also have a program fee, part of which covers your subscription to PT CardioEd and MedBridge. Other costs include uniform requirements, a personal liability policy, and membership to APTA as part of the Acute Care section and Utah chapter. Applications are submitted through PTCAS and are due February 15th. We hold interviews and provide notification to candidates in early March, and our program starts at the beginning of August. It's important to note that there is not yet an acute care specialty board exam, but hopefully will be in the very near future. If upon completion of the residency program, you are interested in sitting for a different board exam, such as the cardiopulm or the geriatric exam, you may need more direct patient care hours in order to qualify. Thank you so much for your attention and your interest in learning about our residency program, and I look forward to meeting you at a future meet and greet session.